So our next progress evaluation, when we met, the back wasn't happy, all right? There was a lot of irritation. There was this numbness in both hips and this irritation in the back. Compared to how it was before we met, how would you describe it now?
It's much better. I still get days where if I spend the whole day on my feet, it feels nowhere near what it was, but still somewhat painful.
All right. So
nowhere near.
Nowhere near. So how much better would you say before, if you were to put a gauge, a percentage?
70?
70%. Are you in pain now as we talk?
No.
No? And it will come on when it's been a long day. So
yeah.
During the day, when you wake up in the morning, it's all right, you're saying?
For the most, I don't know, it depends. If I've had a really long day the day before and it hasn't set in after the day, at the end of the day it will set in the morning.
All right. And how are you waking up at night in pain?
No, not for quite a long time now. So, yeah.
So before we started, what would happen in the night? You'd be
2 a.m. in the morning, or I'd like roll over and it would be like, you know, when you feel like you've got cramp,
yes.
but I don't.
Yes, yeah. But you'd feel it. You'd feel it in the night.
Yeah.
And that's no longer happening, right?
Far less frequent. I mean, once or twice, maybe a month now, as opposed to once or twice a night.
Wow.
Yeah. So
big difference there. Oh, that's excellent.
Actually, getting some sleep.
You were getting some referral that even come to the front, from the groin and the hip area. Tell me about that now.
Today's probably not the best day to ask about it because today it's been particularly irritated. Okay. I think it's because what I've been doing the last few days, which has been sitting at a table, which I actually realise now is more painful.
And if we consider that over, like, of course, like I said, rather than a snapshot of one day or the other, what would you say on the whole?
No, on the whole, it's far, far better. Way better. If I sit incorrectly on the sofa for a long time, I'll be like, you know, you get up and be like, ooh.
Which is expected,
yeah.
But if you're moving, if you're sitting, if you're getting...
Yeah, if I'm continuously, like, active, I don't feel it at all. And then it's more like if I get very lazy and sedentary and sit on my butt for more than 2 hours. I will stand up and be like... Yes.
This high up area, you used to also mention here, have you been noticing pain in this region?
Not as much. If I pick up something heavy, I'll still get that, like...
Momentary? Or will it linger?
It will linger a little bit, but it'll be far more momentary than what it was.
Yeah, I see, good. And tell me about the neck area. How's your neck these days?
Still irritated, but better than what it was, but there's still points where I think because it was the biggest strain place, now, the more we move it, the more I'm feeling that pain kind of coming out of it.
Yes, so now it's sort of been challenged in a way.
Yeah, so it's been challenged, so it's still a little bit sore because obviously it's being manipulated back into where it should be. So now it's a little painful because it's moving back to the right place.
Where is that?
Like right here.
Right, so a localised area.
Yeah, localised.
This is what you feel?
Maybe? Yeah, and then my shoulder blades will, in the morning, if I've spent the whole day picking up things or carrying things, I get like, you know, the feeling that you need to like crack or stretch.
On both sides or one?
This side more.
This side more. When we first said, you mentioned a clear pain in this region. Are you getting that pain now?
I do every now and again, but if I sleep like an idiot, an arm up like this, then I'll, or if I use this arm the whole day.
Yes. Anything else in terms of your general mobility? How do you feel for mobility, flexibility?
I've lost a lot of weight and I feel great, so that's a bonus. Good. And I feel way more energetic and like way more keen to run around and move around. Wow. And I feel way more steady in my feet.
Good.
Yeah.
Good. It gives you more positive outlook, is it? How would you say this is?
For sure.
Give you confidence to
walk and move.
Excellent.
Not
you said You said you've lost some weight. How have you done a program or have you?
No, I think it's just irritation and stress weight that now I've lost because I don't feel like can't move and can't run and can't walk and can't do things.
So that confidence and that moving around, the fact that you're more mobile has other stresses come off and
well, I think because I had lower back pain. When you have lower back pain, you try and walk or run or do exercise of any kind. After a very short period, you get way more fatigued and irritated and frustrated. And now that I don't have the pain as much, I feel like when I'm at work as well, I'm like, it's fine, I'll run that. It's fine, I'll do that. And it's fine, I'll do that.
Wow.
Which is more what I was used to.
Excellent, excellent. If out of interest, how much has been lost? Any kilos or pounds, what would you say?
Well, since lockdown started, I've lost 12 kg, but since I've started treatment, I've lost about 6.
Wow.
So about half of that. Yeah.
Wow. Really,
you wouldn't know looking at me that I was that heavy before.
It was coming up. Yeah. I mean, I've never seen all that. No, that's a good sign. That's a great sign. That's a great sign. Yeah. Excellent, excellent. And tell me about the knees. How are your knees today?
Better.
You used to mention
the swelling in the knees. Yeah, I got better shoes as well. So like that helps from bottom to top.
Mm-hmm.
But I definitely
are you getting pain in the
far
knees?
Less, far less swelling, far less pain. I mean, obviously, if I work a 14-hour shift, then yeah, I'm going to be exhausted all over, and that's just standard.
Yes.
But it's not within the first hour, the first 2 hours where I stand on my feet. I feel like I need to keep shifting weight to not be painful.
Wow. How do you feel? How do you feel you're progressing? How do you feel?
I think really well. Yeah. I mean, obviously, there's still some areas that I still need to work out. Obviously, the neck still being one, but I think the pain that I'm feeling is good pain. It means that stuff is moving, and even though it's uncomfortable, it means that it's uncomfortable because it's actually going to a place that hasn't been in forever. So it's like, muscles when you kind of fatigue them and then you leave them sedentary and then you actually need to go backwards to then go forwards.
Yes.
You go back to the right place and then go forward again.
Yes. And you're very experienced and knowledgeable. You have a previous knowledge base on this, so you know how these things run.
Yeah. So I'm not worried about that pain. I mean, I know it's pain, but it's a good pain. You
can identify a difference.
Yeah.
You can
I can feel like in the morning I'm like, no, it's supposed to be there, so stop irritating it. Like, you feel like you need to be like this, I'm like, stop it.
How do you feel that combination of the home care recommendations and the combination of you coming here and that, how do you feel that they...
I definitely think the coming here and having it manipulated is always better for me. But the stretches and stuff, some of the stretches I can't feel a difference necessarily, and I don't know whether it's just because, like this one, I still get pains through my glutes, and I don't know whether I will ever not get pains through my glutes, or if it's just because it doesn't work for me, it's a stretch. But the combination of the two means that while I'm at home and not having appointments, I can still do stuff and feel relaxed. But there's a few that I do else, like on top of what you give me as well.
Okay.
From physios I've had previous. And they seem to I don't know, I think I'm one of those people that if I think something works, I stick to it. If I don't think it works, then I pretty much am like, that one's not for me. I'm going to leave that one over there then. That's because, I don't know, I've spent forever getting treatments. I'm like, I'm not wasting my time on that one.
So you've had a lot of treatments, and in comparison to this approach that we're doing, how do you feel that this is working for you?
I think chiropractic in general is, for me, the best way to go in terms of treatment. And then combine it with a little bit of kind of physio style is great. But this treatment is really good for me because I know when I'm doing things, I'm like, okay, I don't hurt, this feels better, this doesn't, this does, which is a lifesaver.
Well, I must say, hats off to you. You've been very consistent with your care, you've been keeping up with things, you're moving along as I would expect at this stage, and long may it continue. Doing really well. I think good.
Or inshallah.